gonna go to childhood illnesses. Okay, how about you, honey? What do you think about childhood illnesses?
Well, I wasn't an alcoholic as a child.
No, okay. No, we're not talking about alcoholic, okay, Sir Jack, or smoking, okay?
I'm kidding.
So, with childhood illnesses, the more common, these are your measles, diba?
Measles, mumps, rubella, scarlet fever, chickenpox, things like that.
Yeah, but I'll be talking about just a few, okay? Because we only have 1 hour to tackle it. So, again, we're gonna be talking about the most common. What's the most common is mumps, okay? So mumps, or we call them rubiola, okay? This is a mumps virus, okay? The family of Paramyxo. The genus is Morbillivirus, okay? So the thing with the mumps, okay, these are generally mild diseases. So, it's very uncommon, but it happens, okay? It's very uncommon that someone dies because of measles. And it's usually because of a complication. Because the measles virus, they can go to the lungs, they can go to the intestines, and they can go to the brain. So, the mumps virus, sometimes you will have children that will have pneumonia, that's why they will have cough. And then, they would also have diarrhea. And of course, encephalitis. These are the less severe. This is you don't see them. It's not a typical finding, okay? Unless the immune system of the infant or of the child has been really compromised, then you really see them, okay? Now, what are the cause, okay? And the mode of infection. Mode of infection usually by air droplets. So if I sneezed on Sir Jack, I sneezed on him, okay, the virus will stay in the air for 2 hours, and then someone picks it up, and those virus will enter into the nose and enter through the mouth, okay, and then you can have an incubation period. So the incubation period would last up until 10 to 14 days. So you will have an incubation period, and after that you have a prodromal symptoms. Prodromal symptoms, you would have fever. You have conjunctivitis, coryza, that's what your cough and colds, okay? So you have these typical symptoms, okay? That's the prodrome. And then you have an enanthem, that's what they call it. It's just like a spot, we call it Koplik spots, which you can see at the buccal mucosa, dito sa oral mucosa in the mouth. So that's the Koplik spots. And after that, you will have exanthem, which is an erythematous rash. So they're reddish, okay? They can be macules, papules, that's what they call them, because it's just flat, okay? And after that, generally, if there's no problem, the immune system of the child is good, then the child will recover. So me, I remember having measles like twice in my life. So it's not also true that if you had the measles, that you will never have measles.
Same with chickenpox.
There are incidences that you already had measles, and you will have measles again. So it doesn't confer 100% immunity. Unlike with all the books that most of the books that I am reading, they said that it confers 100% immunity. So there would always be.
Well, there are times where you have something once in your life where you will never have it again. Like for example, when I was about 7 years old, a babysitter fed me beef liver, and I've never had that again.
Well, that's different.
She said I wasn't getting up until my plate was cleaned. I took that and I stuck it in my pocket.
Now, for the herbal remedies for that, again, okay, this is my caution to all of you. If you have any form of viral infection, do not give aspirin to your child, okay? Do not give aspirin to your child if it's a viral infection. There's gonna be a complication for that. We call it Rice syndrome. And it's very vicious. It can cause liver problems, so do not do it.
Let me ask you this one. In a situation of a viral infection, is there any benefit at all to giving an antibiotic?
No, you cannot. But the thing is, if you have some form of viral infection, your immunity might be lowered Okay, and then if your immunity is lowered, then you are susceptible to some bacterial infection. So,
but if there is no bacterial infection,
if there's no bacterial infection, you should not be giving an antibiotic. You should not receive an antibiotic. So for fever, the best thing to do is you can have this ampalaya juice and then you drink them. You can give it every hour, 3, 4, 5 times a day. So you can give that to the infant or to someone who's suffering with fever. Again, also, you can do a compress using
cold compress.
Yeah, cold compress, or you can also use compress using white vinegar. So you get a towel, you put some white vinegar on it, and then put some compress in the infant or in the skin, so to lower the temperature.
Cleaner skin too.
Yeah, and cleaner skin as well, according to surgeon. So, and then if you have conjunctivitis, okay, so reddening of your sclera, so you can use honey with distilled water. Okay, make sure that the honey is sterile as well, and then a sterile distilled water. So usually it's a few drops of honey and then 5 ml of distilled water, and then you can apply that 3 or 4 times in a day. That's for the conjunctivitis. For the cough and colds, you can use oregano, cinnamon, eucalyptus. Again, honey should not be taken internally by infants less than 2 years old because of a condition known as infantile botulism. So we do not have, they do not have the necessary equipment, immunity to fight that type of infection. Okay, so next would be your German measles. So German measles, it's a mild measles. We call them rubella. Okay, so measles, measles, it's rubiola. This one, it's German measles, rubella. These are quite mild, and you can see them. They usually have lymphadenopathy. And German measles would have fever as well, but again, it's mild. Usually around 3 days, they would be gone. So that you would also have some form of a rash. But the thing is, okay, this is only important. German measles is only important for pregnant women, because if you have been exposed to this virus, you would have congenital rubella syndrome, in which the infant, okay, if you are pregnant and then your infant, you will deliver to your infant, you will have, the infant will have mental retardation, sensorineural deficits, usually blind and deaf, they cannot hear. That's why it's important that you stay away. Okay, if you're pregnant, you stay away
from sick people.
Yeah, from sick people. So that's how German measles is. Next is, of course, your favorite, honey, chickenpox. It's his favorite. No, I'm joking. So chickenpox, our children had chickenpox, do you remember?
Yeah.
Gabby and Henry.
Yeah.
So the first time that they had the chickenpox, Gabby, okay, it was only in a few selected areas. I think it was only in the legs, you remember?
Yeah.
It was also only in the legs and then some part of the body. And then after that, Henry had chickenpox. Okay. Now the most distinguishing factor for a chickenpox is a blister. So if you look at their lesions, it's like a vesicle fluid-like. Okay, fluid. It's like a vesicle,
Juicy
and then
blisters.
it's itchy. It's itchy. Okay, and then after that, usually after 5 days, they become a scab, and then they just fall off. And after that, most of them, they don't leave a scar, but some they leave a scar as well.
If you bust open that blister.
Yeah, so the thing is, if you're suffering from chickenpox, again, you know what to do when you have fever. Now it's itching. The best thing you can do is that you take a bath using Epsom salts. Okay, so you have 1 cup of Epsom salts, it's magnesium sulfate, you put it in water, and then you immerse yourself, okay, so the itchiness will be alleviated. Another home remedy that you can use is aloe vera. So you get an aloe vera, you bust it open, okay, you slice it into 2, and then you get the gel, and then you get the gel, and then you just put it in your body. Another can be zinc oxide. If you have zinc oxide, it's available in some pharmacies,
shops.
in shops and everything. So you can just use that, and then you can apply it on the skin. So that would alleviate some of the itchiness. Okay. Now the problem with Varicella Zoster, okay, which is your chickenpox, some of them, they stay dormant. Okay. When you talk about dormant, they sleep. Okay, they sleep in the nerves. Okay, we call them dermatomal. So when something happens, you get stress, there's burns, or some form of immunity that would lessen your immunity, then you would develop shingles. Okay, so it's like chickenpox as well. So you can see they would be vesicular, but it will only appear on a dermatome. It's like a patch. It's all gonna be that's a distinguishing pattern there. Okay, it's like a patch and it's very painful. You can you call it post-herpetic neuralgia. My dad had it and it was so painful. It took around 6 months before the pain goes away. So, but it will stay there. The lesion will usually stay for around 4 weeks. Okay, and then you can put again white vinegar, honey. Okay, these vesicles are infectious. So like with the Varicella Zoster, you can infect through respiratory droplets and also with the vesicles. So be careful. Do not touch it because it has some viruses on it.
Somebody scratching on it.
Yeah, so that's another childhood diseases. Another childhood diseases is the most famous. What they call that, honey? It's mumps.
Mumps?
Mumps.
Mumps.
Did you have mumps when you were young?
Probably at some point. I just don't recall.
Okay. I remember my mom. I had mumps. I just do not know. For every one of you who knows what it is, I remember when I had mumps, and then my mom put some blue thing here. I just do not know what it is.
And I mean, I used to be real. I used to have a really bad memory. Now I just forget things.
I think they put some blue. They put some blue object here. It was a paste that they do, and to alleviate it. I do not. Yes, Beckett, moms. I just do not know what you call them. Do you know?
Yeah,
object? Do you know? They put a blue thing here. Agnel color blue. I do not know. I have to do my assignment. I do not know what Agnel color blue is. Yeah, so they put it here. And again, with mumps, it's the mumps virus, of course. It's another part of the paramyxovirus. So they put something here when I was young. So you have bilateral swelling of the parotid. Yeah, Tina daw. Tina yung color blue. Yes. So, okay. So you tell me later because I'm very interested on what is that. But I remember my mom putting that in my parotid. So again, with mumps, you have bilateral parotid swelling and again a lymphadenopathy. So these are generally mild, and the people that are usually infected are 2 years old up until 14 years old. And if it's a recurrent thing, okay, you can have some form of orchitis. Okay, kaya sinasabi nila, it's, well, they know it. It's like they were said, it's a sterility. Diba? Sinasabi ninyo lagi, ay, pagka lagi ka nagkakamams, mababaog ka. Yeah, so that's what they were trying to say. It can form, but that only occurs it occurs only a small percentage, okay? It's just, if it's persistent, then that can happen. But if it's once in a while, no, don't worry about it. Yes. I will, Agnel, that's what they call it. Agnel, that's the blue powder that they are putting. So all the Filipinos know it. Me, I just don't know it. Yeah, so it's
slobbering everywhere, Mom.
Yeah, I'm sorry. So I will do my research. Yeah, so thank you very much for telling me that. So I will do my research on mumps or Agnel, that's what they are trying to say. Okay, so another childhood illness. So this one, Kyla had this, and I remember she was very young. She had a fever, and it was high fever up until 39 degrees Celsius. I don't know what that is in Fahrenheit.
Hot.
So 39.5, it was so high. She had fever, persistent fever for 3 days. And after that, it was gone. The fever was gone. But then, there was a skin lesion that came out. And it's also a viral infection. you call that erythema, it's exanthem subitum or Rosola infantum. And again, these are mild viral infection, and after that you just you just do hydration. That's the most important thing to do, is you do hydration. And the most important thing is to have a very strong immune system. So if you have a strong immune system, and this all viral infection will just go away eventually.
Don't you say that basically if you treat these, they take about 7 days to clear up, and left untreated, that takes about a week?
Yes, they're basically the same. Yeah. So again, just to wrap up about common childhood illnesses, it's very important to have a strong immune system. And what you can do to have a strong immune system is to take vitamin A. So vitamin A, vitamin C, and zinc. Okay. Also magnesium. Magnesium can help with to build up a very strong immune system to fight all of those offending organisms. So that's how that's the end for our infectious diseases. I hope you enjoyed. Yes, go.